Thank you for joining us again for another educational video this Friday. What I'd like to talk to you guys today about is a concept called ovarian reserve. So ovarian reserve is something that is critically important to all patients that are coming into our practice to try to help them determine how much time do they have and how many eggs do they have left. So ovarian reserve is really a term in our field used to refer to how many eggs are present in the woman's ovaries and how much time do we think they have left for their ovarian function before they run out of time. Now you need a little bit of background on this. So physiologically what happens is women are born with all the eggs they're going to have in their ovaries. And then they lose them throughout their reproductive years until they would run out, which would be menopause. Okay? So we know what the normal process of the ovary is going to be, which is to lose eggs. Not good for us because we want those eggs for pregnancies. So ovarian reserve is saying, where are you in this continuum? Where are you? Are you down here and we don't have much time? Are you up here and everything's okay? Doesn't matter what age you are. We find patients who are in their 20s who have very, very low egg numbers, and I find women in their 40s who have high egg numbers. So regardless of what your age is, ovarian reserve is an important tool to assess what kind of treatment you need, how aggressive do we need to be, and how much time do we have. So there's different ways of assessing ovarian reserve. There's different tools that we use. In my practice, I like to use a couple of them to make sure that they're consistent with one another. But one thing that we would do is an ultrasound. Ultrasound is using sound waves to look at the ovaries, and we look at things called antral follicles. Antral follicles are where eggs are kept. So obviously the more of those little follicles I see, the more eggs you have. The fewer the follicles I see, the fewer the eggs you have. And there's certain numbers and cutoffs that we use that I don't think are important for the video. The other things that we can do is we can draw blood tests on patients. We can get an idea on what's a certain hormone production coming from the eggs in the ovaries. So I can draw that blood test anytime. It's called an anti-Mullerian hormone or AMH test. That also gives me a good idea of egg numbers. There's older tests that we used to use too, which are hormone blood tests that are very specific at the time of the cycle, which is trying to tell us, what does your brain think the ovary egg number is like? So if your brain is sensing that egg numbers are low, then that would be reflected in the blood tests. Those are hard to do and timed just right, so we don't usually use them as much as we used to use them in the past. But when we assess the ovarian reserve, we go through that with you and tell you what we think your ovarian reserve is, what does it mean for your overall reproductive planning, and also if you're going to undergo certain treatments like in vitro fertilization, then that also gives you a good gauge as to what to expect for egg numbers in your IVF cycle. So that means if you're expecting high numbers, we should get high numbers. If you're expecting really low numbers, then you need to know that information before you actually embark on that treatment. So it's a really good assessment tool to use. If you want to learn more about ovarian reserve or assessment, or you want to get your ovaries assessed, please contact the office.